I stumbled upon this career path. I thought, who would want to be a hospital chaplain? While I was in seminary, I had to take what's called a field experience. We're focused on theological formation and exploration, but at some point, each student is required to put it into practice. So what I did is I waited too long, and the only thing that was left was an internship at a hospital. And I thought, man, all I'm left with is this internship at a hospital. So no, I had no interest in being a hospital chaplain. But with great reticence and reluctance, I called the hospital and asked if I could be accepted into their internship program. They accepted me. After I completed my first internship, I actually hated it. I thought, who in their right mind would want to be a hospital chaplain? There's weird smells, there's suffering, it's totally chaotic. And I walked away thinking, I never want to do this again. But I still happened to impress the supervisor, the manager of the spiritual care department, and he asked me to come back for a second semester. So I was like, wow, do I really want to do this? But I was kind enough to accept it because I figured finding another internship would be hard. So this was already there and I did it. And it wasn't as bad the second time. I thought, you know what? Okay, this is not as bad, but it's not for me. It's totally not for me. And after that, I completed the second internship, and the director came up to me again and said, hey, I'd like to offer you a per diem position, which means sort of a part time kind of position. So I took it. It helped fund my seminary education, and I started to develop a more empathetic spirit than when I was first hired on. I started to feel connected to patients and families in their suffering. But I'll tell you, things really changed for me when I changed my theology. In the course of my seminary training, I started to discover Catholicism, and I became a Catholic. So my theology changed quite a bit. And once my theology changed, it gave me a better framework to understand suffering, to find meaning in suffering, theologically speaking. And it helped open up my eyes to become really empathetic and to become uh, really understand what it means to sit with someone in their suffering. And so that really changed everything for me. Much later, after I became a full blown Catholic, I rediscovered the hospital chaplaincy and I was encouraged to do it again. I came back with a greater appreciation, a greater sense of empathy, and a greater sense of joy with my faith. My Catholic theology really provided the framework I needed to understand why I was there as a chaplain.
So, let me close my door real quick. I always knew I wanted to work in prevention and wellness. I really knew I just loved the whole, that exercise is medicine. I had asthma as a young girl and they just medicated me like crazy and told my parents that I couldn't exercise and it was horrible. So I just got fat with steroids. And so for my body to just be stagnant, it was like miserable. And so, when I was about 14, I started working out. And, I really could monitor my asthma through lifestyle. So I was very interested in health and wellness. And I got my degree from Pepperdine University in sports medicine. When managed care came out in California, I led the preventative care and health education department at Prime Care. So here I am, like this, sports med major from Pepperdine. And it was a Friday afternoon. And I got a call from a physician saying that all my educators are out and I have a stat diabetes consult. I need someone to come. And he goes, I just need somebody, Dora. So I go, okay, I'll come. So I went on this, it was a 16-year-old girl who was type 2 diabetic. And so I drove on this call to his office. And as I got off the freeway, there was like not a sidewalk to be found, fast food on every corner. And I get in and I start talking to this young girl, and she proceeds to tell me about her sexual abuse from her mother's boyfriend. And so, I mean, it was just it was like the big red truck moment for me where I said, okay, this is not working. So that's when I went into public health and started really getting educated around how do you incorporate the social connectivity? How do you begin to think about this in a more holistic way? So I became really interested in, whole person care, body, mind, and spirit, and also the complexity of public health. And that's when I began to work on my doctorate at Loma Linda University.
Nope. Yep. Nope. Yep. Nope. Yep. Nope.
I've been a lifelong educator. I was a school principal for, 11 years or so, kindergarten through 8th grade school. And that's a long time for any school administrator to be in one spot. And it's always good to be refreshing as you go along in your career. It's good for the organization, it's good for you. And I was just sort of like, this is a great gig. I love my community. But at year 11 or maybe year 10, I started thinking, what else can I do? And so I started looking around at other industries, and my husband was looking on LinkedIn.
Hey, look at this, Nancy. Chief Mission Integration Officer of Providence St. Joseph Health. That sounds like you.
The first year was hard. It was hard because I didn't know anybody, and it was an industry that I had never worked in. And so it was a little lonely just having to walk in and not have relationships. I'd say that was probably the hardest part, especially for my personality at first, because, I was really used to having a team. When you're leading a school, you can walk in and say, hey, Julie, how's Sarah's broken ankle? Or, you have those connections. And so that was hard not having that. And because my position now is regional, I don't necessarily have one team. I have, 100, 150 different teams that I visit. And so I actually made that comment to somebody one day, one of my clinic leaders, and I said, I just feel like a visitor everywhere I go. And so she goes,
No, Nancy, that's not true. You have 150 families everywhere. Like, these are all your families. You can walk in at any time and know that you're part of that group.
But now I really do feel like that. Like I have 150 families. Those relationships have helped me through this pandemic. Especially, when the fire started this year, where I really started to feel it emotionally was when I couldn't even open my window. When the air quality was so bad, it was crazy. I mean, it's like The Walking Dead or something. It's an apocalyptic movie. Because in Northern California, we don't really have autumn. We have fire season. And I mean, good grief, we're sort of getting used to this, but we were hit really bad back in 2017. 153 employees lost their homes. And shortly after that, we were sitting around and we're like, not everybody can donate money to help because some of our caregivers, they're frontline and they make minimum wage. The average medical assistant can't replace somebody's home, but they want to show that they care. So, they want to show our organizational values of compassion and integrity. So we got this idea. We wanted to make comfort kits, and I think I might have seen it on Pinterest or something. But basically, these comfort kits were plastic gallon-sized baggies that contained things like chapstick, granola bars, tea, comfy socks, and essential oils, and a little card we put in them. And basically, the message was, we're thinking about you. We know we can't fix things. We know we can't make it all better, but we really care about you. I think that self-care stuff is just really important. just finding whatever it is that nurtures your soul is extremely important. So we put these donation boxes out all over these medical clinics that weren't affected and told people to drop the little goodies off. And we started doing these packing parties that got everyone really involved. And we collected a lot of little goodies. And we must have created 1,700 comfort kits. So to deliver these, I actually rented a van. And, I really wish I had a picture of the van. But my husband, I don't think he will ever forgive me for this. So he's like,
Oh my God, the cost of the van, Nancy. Like, you could have just gone out and bought those things up there. You're really going to drive that far with a van full of cozy socks?
But the whole point is that these caregivers felt empowered now. They felt like they were doing something.
So we drove that darn van from Anaheim to Napa.
And we packed the van to the brim with comfort kits. I would deliver these and say, these came from Anaheim. They want to do something for you. Here are these little comfort kits. And, imagine how important they felt. The caregivers there would open these bags and go,
wow, this is from our own ministry. Medical assistants and receptionists in Anaheim packed this.
It was like a grassroots effort that was really hands-on, and it made everybody feel like they could do something. I got a message from one of my managers up in Humboldt the other day, and she was asking me about the project.
Nancy, remember when we did the comfort kits? We want to do that. We want to provide comfort kits. So what do you think? What should we pack? Can I have the old flyers? You know what? I want to launch this. It may not just be our caregivers that are going to receive them, but we can give them our firefighters, and we can give them to folks out in the county that are really fighting these fires.
I was just so happy, just as a leader, because one of the greatest lessons is, it's not about you doing the work. It's empowering other people to do the work. And that will really bring out their best selves and their skills and their talents. And, in some ways I was frustrated that I wasn't going to be able to go up there to help lead it. But at the same time, I was like, Carrie, you know what you're doing. You've got this. This is awesome. Go for it. And so she's like leading it. She's creating flyers and she's doing this, and they're launched. They put boxes out at all the clinics, and they're going to repeat the whole effort. And I'm so glad they're doing it again, because especially now during the pandemic, I just want everyone to know, you are not alone. You are in this with people who are also hurting and suffering, and whether it's physical pain or emotional pain or spiritual pain and isolation, it just breaks my heart to think that anybody feels like they're by themselves. And is it going to change the world? No, it's not. But is it going to make somebody feel like I'm cared for? Absolutely.
We have a lot of issues as a Catholic healthcare entity. It's misconceptions. Oh, they're a Catholic system, so they're not going to do this. Oh, they're on this side of this issue, so they don't support that. So really navigating those misconceptions, how we do that is we always lead with our mission, which is to care for the poor and the vulnerable. So if we're talking with a Democratic lawmaker or a Republican lawmaker, even though we might disagree with them, they understand where we're coming from because they know it's grounded in our mission to care for the community. But that was pre-COVID. I'll tell you what, I couldn't believe the things I saw and the things I heard during this crisis. The biggest thing was to get the government to act fast, which government moves at a glacial pace. We had at Providence, we had the first COVID patient in January. First COVID patient in the US was in Washington State in January, and then in Seattle. Seattle was really the first big city to be hit. Then it kind of migrated from Europe, and then it came to New York. But so I was standing up and down, waving my arms, jumping up and down, saying like, this is a huge issue. We need supplies, we need testing, we need PPE. And the country was like, oh yeah, whatever. I mean, so we were like, I sent an email to our senator, right? Saying that we were running out of PPE. COVID numbers are doubling, right? We're going to run out of ICU beds. We're going to run out of everything. And then that email got forwarded around. And then I got a call at around 10 o'clock our time, 1 a.m. DC time. And it was the Washington Post. And they were like, we got your email. We understand things are really bad in Seattle. What can we do to help? So then there were articles written on it. And I spoke with the Wall Street Journal and with like the New York Times and about what we needed. So I really think our biggest challenge was elevating the crisis at the beginning because people didn't understand how bad it was going to be. And then there's kind of this attitude of the federal government that we're like, well, you're on your own. States, you're on your own. And so we're in 7 states dealing with multiple state processes around PPE, helping all of our leaders navigate how they access ventilators, how they access N95 masks, and how you do all of that. My job is I had to go to our leaders to see, okay, how many ventilators can you give me? And this is the reason why we need them. Which, I mean, what I do is lobbying. But you have to lobby internally and externally to really make the case to our leaders. So we ended up donating 500 ventilators, and 50 of those ventilators were used at the beginning of August for a hospital in Texas that had run out. So my job is to make sure that we're helping our whole hospital community and talking leaders into doing things that they don't want. They want to do it because they know it's the right thing, but they have to like mentally get to that spot, you know? And I forgot the best part. There was an issue. We were trying to get the Navy ship that was docked in San Diego, the USNS Mercy, up to Seattle. And then working with Governor Jay Inslee to get it up to Seattle because it was promised to Seattle. And then suddenly Governor Newsom is like, no, I want the ship. We need that ship. We have all these people in LA. And we were calling the admiral of the Navy saying, we need the ship. We have this many people. And then Governor Newsom was on it. And then we were like tweeting about it. It was a whole thing because we were even talking to the Secretary of Defense. So they were like fighting over like who was going to get this ship. And ultimately we got in Seattle field hospitals. Providence either way was fine because we're in LA and Seattle. And we ended up getting FEMA to send field hospitals to Seattle. 5 field hospitals, and then the ship went to LA. And guess what? Neither were ever used.
You ready for bed?
Yeah. Hey, Dad, can you tell me a story about your work?
Yeah, of course. Well, you know, it's tough. I have the responsibility of trying to keep all of our providers in a good headspace, keep them engaged, you know? I left the for-profit, fast-paced world to come into something where I thought I could maybe make a difference.
Uh-huh.
It's tough to make sure we're providing all the things they need in a time period, where you're not nearly getting the revenue that you're normally getting. It's tough, when there's an immunization available, who goes first?
It's tough.
It's tough. There was a supply shortage and there was a lot of fear. Like, are we, going to have enough masks, enough gowns? It's tough. How do you prepare clinics for patients that are coming in that have, COVID-like symptoms, and they're mixed in with patients that are just, there for something else that's unrelated to COVID? So we had to create a lot of different specialized clinics that were like tents. And in areas that patients that had illness-like symptoms for them to come through and, screen them.
Tents, like camping?
Sorta, yeah. It's tough. We had to do a lot of logistics and help and yeah, make big changes fast. Fix your pillow. That's just gonna hurt your neck tomorrow morning, and then you're gonna complain to me. I don't want to hear that. You know, it's tough. Part of the work is, we do a lot of team building stuff. We obviously do reflections a lot, and we just try to center people and, say, okay, let's not talk about COVID at this point. Let's not talk about clinic operations. Let's just have a conversation about how you're doing. Like, share something, like with what's the craziest thing that has happened to you when you're working at home? Because it's nuts. It's tough. So just try to make opportunities for people. Just open up and, share and just lean on one another and just be human. And let's just stop trying to be robots. There was a point where we were meeting at like 6:30 in the morning and trying to make sure supplies are getting to the right place. And like you start to just lose your mind. It's all just, tough.
I don't want to go to school tomorrow.
It's just online.
Hey, Dad, what's immunization?
Well, basically, an immunization is
I like mommy's stories better.
yeah, I do too.
It was shocking, disturbing, shocking, scary, pandemic. He was my patient, one of the first diagnosed here at my clinic. A semi-homeless man, worked at the airport, lived in his car. The ER diagnosed him, released him alone, sent him away to a motel. He had no home. I learned of my patient alone. No process in place for his care. How would he get food, water, medicine? He was alone, locked in a room. Would he leave, infect others? It was up to me, my leadership, to bring everyone in line, learn how to care for this patient, for a member of this community where he was not alone and he did survive. My first patient, such a heavy experience, as though the weight of the world were on my shoulders. A pandemic. And this was only the beginning.
God.
It'll get easier after physical therapy. Your muscles will be weak since you haven't used them in 9 days.
What? What do you mean? What? Oh, what happened to me?
Oh, Darren, I'm so sorry. I thought they already explained everything to you when you first woke up.
Uh, no, not really. I mean, I think maybe they did, but God, I can't for the life of me just remember right now.
Well, don't worry. I'm happy to catch you up. This might be difficult to hear, though. Are you sure you're ready?
Yeah, yeah, I'm ready. I want to know what happened to me.
Of course. I completely understand. Essentially, you are our very first COVID patient here at St. Joseph's Hospital.
What? That can't be true.
Yes, I know it's hard to hear, but you were actually really lucky to be our first patient. Well, as lucky as someone in your situation can be.
Wow. I just can't believe that happened to me. I mean, me of all people.
You were put
Wow.
on a ventilator for 9 days. That sounds bad, but you were lucky because right now our hospital is full of COVID patients, and there are more coming in every single day. We know much more about the virus now, but when you first got here, we had the resources to focus on you. I believe that was a huge reason why you survived.
I know you probably aren't supposed to tell me this at least right away, but it's all I can think about. So did I almost die?
You deserve to know the truth, and as a medical professional, I would never hide it from you. There were times when we didn't know if you were going to make it. You kept fighting and you never stopped. You were on the edge of death, but you came back every time.
Oh, gosh. I had no idea it got that bad. I mean, you keep saying I'm a fighter, but I can't even pick up a phone right now.
Don't be so hard on yourself. Like I said, being on a ventilator for so long weakened your muscles. You're also likely going to have to go through a lot of tests in the next few weeks to make sure that the virus and the ventilator didn't do any long-term damage. It's going to get better, Darren. But keep in mind, the hard part is just beginning for you. I'm sorry. This is a lot to put on you right now.
No. Thank you. Thank you for your honesty. My God, my poor family.
Speaking of your family, I believe it was your wife on the phone call you missed earlier. Here, let me help you.
Right. Thanks. Oh, and before you go, I just wanted you to know that your kindness is something that I will remember forever. I don't even know what to say. I mean, you and the rest of the staff, you've saved my life, and I will never be able to repay you. Thank you. Thank you for everything. I mean, really, thank you.
Darren, repaying us is the least of your worries. This is what we do. None of us signed up for a global pandemic, but that does not change our willingness to put down our lives for the health of our patients. It's nice to get a thank you, though.
Hello? Darren? Are you okay?
I'm fine.
Oh, thank God it's you. I was worried when you weren't picking up.
I'm so sorry to worry you again. It's so difficult to do anything right now. My hands are like jelly. Believe it or not, I dropped the phone when I tried to answer it.
That sense of humor coming back is how I know I have my husband back.
A nurse, actually. She helped me call you and she explained everything to me. I finally understand what happened now. It must have been so difficult for you when I was on the ventilator and worrying that each day could be my last.
Of course, it was difficult. Thinking you might never wake up. I didn't want to imagine losing you, but I had to. I had to call the insurance company and talk to them about life insurance. I had to tell the kids why you were gone. And I couldn't even be there with you. I felt like you were completely alone. When you started getting better, it was the best day of my life. The staff at St. Joseph's were our saviors.
Yes. And that became so clear to me as I spoke with that nurse. Oh God, I didn't even get her name, but her kindness, it changed my perspective. I mean, she was so compassionate, taking the time from just the hell that she must be going through to explain to me what happened and to help me use this phone. I don't know if she's a woman of faith or not, but in that moment she was God's presence to me. The whole staff, they have all been God's presence to me in a time that I have desperately needed God. And I'm not isolated here or alone because I'm surrounded by that staff, and I'm just eternally grateful to the people who've healed me.
Wow, there are so many stories. My goodness. As recently as today, without trying to violate what's called HIPAA, you know, incredible. Today would have been a good one to share, but it's so fresh and there's so many details to it. I guess I'll have to share this one. It wasn't as recent as today, so I'll have to think back a little bit. As you know, COVID has changed people in incredible ways. It's even changed the way we provide spiritual care. Before, we'd be able to provide patients without really any limitations. We'd just be able to walk into a room and expect to see family members, expect to see people at the patient's bedside, and that's no longer the case. There was an instance where there was an end of life situation in which a young person was actively dying as a result of COVID. This young person was unable to have family be with them in the bedroom, and that's when patients need to be with their families as they are transitioning, as they are actively dying, and they were unable to have that interaction. The staff finally made an allowance to allow this patient's significant other to be with this actively dying patient, but the significant other really thought that it would be important for family members to participate in some way. Well, they couldn't be there physically for several reasons. The hospital policy was not to allow any visitors to prevent the spread of COVID and just to keep things very, very simple. So what we had to do was, instead of having a large family or a group of family members by the patient's bedside, we had to be creative, utilizing different video chat platforms. So what we did in this instance was we actually did a Zoom call at the end of the in this patient's room, because I myself wasn't actually allowed inside the room. I was outside and trying to orchestrate this end of life ritual they asked me to participate in. I have this patient's significant other at my side and the entire family. It was a large family. There were people from all parts of the country who wanted to be there, who couldn't actually be there, part of this Zoom meeting right outside, right at a window of the patient's room, which was a glass door. And this, in my phone over here, was able to orchestrate a liturgy that was congruent with the patient's respective faith tradition. And everyone who could be there, who wanted to be there, who couldn't be there actually, was there over Zoom. Though this patient was unfortunately not alert and oriented. So but it brought comfort to the patient's significant other. And I apologize if I may sound vague. I'm trying to avoid pronouns, but that's one story of many that will never leave me.
Okay, so on March 15th, 2005, I was actually driving to a class at Loma Linda, and I was listening to the radio. And I heard about a terrible accident on the 10 freeway. And it was involving a fire truck that had been hit by a tour bus. So I called my husband. This was before cell phones. And so I called my husband at the fire station. And they said, Dora, who told you to call? And I said, they didn't. I heard on the radio and I was just calling to see how Tom was. And they said, are you alone? And I said, yes. And they said, let me call you back in 5 minutes. Could you please find somebody to sit with you? And they called back and it was the captain. And they said, Tom's been hit by a bus responding to a call on the 10 freeway. And you need to get to the trauma center as soon as possible because they don't expect him to live. So, the professor that I was sitting with drove me to the hospital. It was a tour bus that was going to a casino, but hit the fire engine at 80 miles an hour. And the tour bus, there was, multiple patients on the tour bus. And when I got to the hospital, they were in lockdown for disasters because there were so many. And so I sat on the floor of the waiting room entrance just sobbing. My daughters were 7 and 10 at the time. And so they finally let me in and they said he's had a traumatic brain injury, that his lungs, they couldn't inflate his lungs were crushed, and named God knows what else. And it was such a violent accident that it was on CNN, it was on Fox News. And so the press and everyone and their mother were there, and everyone said, what can we do? How can we help? And I was just a mess. And, I was trying to keep my kids away because I didn't know how to tell them. And I said to Tom's brother, ask people if they'll pray. And that's what went on CNN for 3 days. So I literally got a tub. I probably a few feet wide by 4 feet long, filled with cards that people sent me that said they were praying for my husband. And people did fundraisers because they thought he was going to die. And about 2.5 weeks later, he came out of his coma. And, they started intensive therapy. Again, no one expecting him to walk or talk, so slowly started making improvements. He was paralyzed on his left side. After about 6 weeks, I said, I want to take him home because it was just exhaustion. You can't even imagine the exhaustion. And so I brought him home and said, I'll take him to therapy every day because I just wanted my girls to have some type of normalcy. And about after 4 months, he started walking on his own. He started eating on his own. I made a pretty, with my background in physical therapy, like they called me the hawk because I was relentless. I was on top of his care. I said, failure is not an option. And within 7.5 months, we were preparing for him to go back to work. Within a year, he was back to full duty. I incorporated everything that I'd ever learned about healthcare, that it's community-based, that it's about social connectivity, it's about proper nutrition, it's about appropriate care at the right time. Tom was a miracle. But people had raised money thinking he was going to die. So I had all that money and I started a non-for-profit organization called Partners for Better Health. And it was about, really creating a new system of care that is more holistic. How can we create conditions for people to heal, for people to be healthy? So that's kind of my love. I always say that's my ministry. So it's pretty exciting just to see how things have come full circle. And last December, my husband retired. So 30 years in the fire service, full service retirement. I'm not saying everything's perfect and easy and all that, but he does well. He does really well. My kids, Katie is 23 and got her degree in psychology. And then Rebecca is just starting her master's, specializing in the public and nonprofit sector. So I feel like, wow, okay, 15 years and I did it, It's like, thank you, God. And now, just really thinking about with all that, what am I to bring to the world in my next chapter? It's about inspiring the next generation to not think dismal or we can't do this, because we can.
The story of my life. Let me see. I guess the best place to start is the story before me. My parents, they immigrated from Mexico in the 60s. They were brave. They were ready to go, ready to fight for their dreams, an unstoppable team. And then they had me. I grew up in a high density apartment building, but I'll stop you right there because that place was fulfilling. The rich culture of the undocumented spilled from the walls, a community to catch you right after you fall, a community that struggled. And ever since I was small, my family and I would answer their call. I loved my community. I loved them all. No, it wasn't a mansion or a fancy estate, but within those walls, I learned something great. I discovered that my voice holds weight. I discovered my power to create, to advocate. I discovered my fate. I wanted to help others, but needed a foundation. Immigration. A lawyer, I suppose, but deep down, the cons, they outweighed the pros. And then came the post office. I questioned my choices. All I wanted to do was give a voice to the voiceless. Will I be a lawyer? Will this help others? Or maybe this is a job that's meant for another. Stacks of applications swallowing me whole. It takes a toll. This decision won't sit well with my soul, so I fold. And the applications fall into the trash. You may think that's rash, but I don't. I think that's life. I won't be a lawyer, so I say goodbye. Then suddenly healthcare catches my eye. My degrees are in history and poli-sci, but I will not leave these communities high and dry, so I'll try. I moved to Brooklyn with my husband to answer the call, but a week before school, I had a terrible fall. I slipped off the stoop of our building, had my foot reconstructed. All of a sudden, my life was obstructed. In New York City, getting my MBA, confined to a wheelchair. What can I say? I was afraid. All I could do was pray. It was a reminder that my learning wasn't done. It wasn't fun, but I learned something true. You've always helped others. Now, let others help you, and you'll get through. That's what I remember. I was out of the chair in the snow in December. So yeah, COVID-19 played out and we were still learning what it all was about, but without a doubt, I said, it's coming to California. It's coming. So how do we prepare? How can we be there, ensure we're all treated fair? How can we care? We don't have all the money in the world, but we needed to support the community. No one has immunity, but everyone needs an equal opportunity. What we need is unity. So we brought in a number of funders, health systems, foundations, donors, scholars. We put down $100,000, a starting amount, and the money speaks. Their interest peaks. We raised $4 million in just 6 weeks. It was amazing what we could do with the proceeds. They went towards stipends for families and other basic needs. We succeed, but there are still those in need. It seems to be the worst year of the decade. The pandemic, the fires, the racism displayed, sick families relying on Medicaid, it's a lot. And it won't be solved with the Band-Aid. COVID-19 played out. I'm doing all I can with what we've been advised, but it's hard. And my immune system is compromised. Cancer. I had cancer. Chemo. I did chemo. So that human connection is just out of reach. I want to get coffee with colleagues, go to the beach. I miss going into communities. I miss the outreach. COVID played out. A new normal begins. A life raising my beautiful 3-year-old twins who are both bilingual and both Zooming for school. So that's been cool. During this time, I think what we need urgently is to ask ourselves, what do we want to do differently? After the pandemic, the virus, the sustained isolation. And the truth is, it's up to your generation. The future of the nation stems from your future creation. But I have faith. You'll be our salvation.
The question is often posed to me by family and friends, like, Joshua, how do you do this on the day to day? Well, just to put it out there, it's not actually that intense every single day. I would say hospital work is the most unpredictable type of work. You can be in one moment providing a blessing for a baby, and you can be called to a code blue, which is a patient experiencing full cardiac arrest. And the patient can die. So you're there providing support for families that are grieving. We're subject to our own fears and concerns, Where are we in this pandemic? What's the state of our health as a country, the state of our health as our hospital? So, while we're providing support to our staff and patients, clinicians, chaplains are also in need of that sometimes. And we get that support from each other, our community, and through our own theological reflection. We're there for each other too, because we're on the front lines too. We have our own moments in which we experience fear and sadness and fear of the unknown. But the way I cope with it, I've become better at self-care over the years. It wasn't always the case in the beginning, but I've progressed through my profession. I've become more aware of who I am. For me, I really enjoy solitude. I think there's a lot of power in silence. And then, of course, there's regular stuff on the day-to-day, taking walks. My prayer life certainly helps. And, I'm a normal person too. I'm into Cobra Kai. I don't know if you know what Cobra Kai is. And I spend time with my family. I have great family support. I have great siblings. I'll go see my brother in Las Vegas, go see him, go see my sister, my nephews, hang out with them. So, just spending time with family and getting lost. Final thoughts would be, chaplains are there when patients and families need us most. I'd say we are like the army who sits vigil for when patients need us. Nurses and doctors are there to make the initial assessment. They're very busy, very in and out. Sometimes patients need more than just that from a clinician. They need someone to sit with them, Doctors or the Marines, in and out. Or the Army that stays behind. We're there to listen to patients' stories and help them process. Healing is not just about physical healing. It's about emotional healing, spiritual healing, and of course, physical healing too. That's our job as chaplains, healing.
When talking to Father Gregory, I noticed two things. One, he talks like a priest with that comforting, familiar cadence that makes everything easy to listen to. And secondly, that he always answered questions about himself with stories about other people.
When I got into an accident at work and lost my leg, I thought my life was over. All of a sudden, my entire life changed, and I thought it was for the worst. But, Father Gregory helped me stay true to my core, to embrace the struggle, and to see where it leads us. And I eventually actually wanted to get a prosthetic. I didn't want to go back, but I wanted to move forward into the light that Father Gregory showed me.
I've been through treatment after treatment for my cancer, and the fact that I'm living is a miracle. But this being home all the time, I know it's safe, but it's very easy to feel alone and hopeless. I'll text Father Gregory every so often, and he always asks me, where is the light? What do you hope for? And I always have the same response: my roses. I can go to my backyard and trim my roses. And it's those simple things that make things easier. Father Gregory always reminds me to find that little light.
I wrote a letter. I didn't know what else to do at that point. I hadn't been able to see him since this whole pandemic began. And I said, my husband is dying. Please, is there anything you can do? I just needed to see him. Father Gregory heard about the letter, and he was able to move my husband into a room where I could finally see him. It's just Father Gregory saw me as a person who needed help. And he was able to take away all this politics stuff so I could safely see my husband. Father Gregory saw me in need and reached out his light.
He also shared with me some stories about physicians working through the pandemic.
So I was talking to another physician who said that they wanted to take some time off during the pandemic because, they were scared. And so I asked, what are you scared of? And they said, well, this pandemic is just the worst of human illness. And I said, well, why did you become a physician? What do you mean? We became physicians for when it's not wonderful. And that's our mark of service. I told Father Gregory this, and I told him that I didn't think I'd been kind. And he told me that I was living out our oath. He said, you cared for him, you eased his way, and you reminded him of his service. And I guess he's right.
But working through this pandemic has been hard, isn't the right word for it, but there's been a specific toll on my family. When I come home, my kids and my husband are waiting for me, and I immediately strip out of my clothes, which I throw in the wash, grab my robe, and I shower immediately. I walk out of the shower, beet red. My husband tries to joke that I'm trying to scrub off the first layer of my skin. And I am. I'm so scared for them. My biggest fear is contaminating them. Father Gregory knows this. He knows it's hard. And he's been able to set up a buddy system so everyone is checking in on each other outside of work stuff. I can have at least one conversation a day that isn't about work stuff. Something more lighthearted.
He also shared with me another story about an orthopedic physician working through COVID?
An older orthopedic physician, one I worked with in my office, who was always there to listen to other caregivers when they were going through hard times. One thing he always did was walk patients back to his office, one of his favorite things to do. But with COVID, you know, he wasn't able to do that anymore. One day he said to me, sort of out of the blue, you know, marriage can be really tough at times. And I said, yeah, it can be a challenge, but, you know, you talk it out and work it through. It turns out a week later, he committed suicide. It was just so horrible and upsetting for everyone involved, even though there's nothing anyone could have done. It's hard to be the one who didn't notice, to feel like I was the one who failed to care, but
Father Gregory saw this as a deeper reminder to ask ourselves if we are checking in with people during this pandemic. Because if we are checking in, we might know more of the story. And the story could be the catalyst to listen to someone and to care for them and ease their way. As we were wrapping up, he told me one more story. He showed me the ring he was wearing, his maternal grandfather's ring. And he told me how his grandparents lived through the pandemic of 1918. I mentioned how it was funny that everything sort of comes full circle like that it's sort of comforting that things line up. And he said, well, now that you mention it, my maternal grandmother's name was Emma, which is my name. So I can't help but think about my story with Father Gregory's stories, that this conversation was supposed to happen, that I was meant to see this light at this specific moment. Because I am going through the grief of losing a friend very dear to me. In the midst of feeling just the crushing weight of hopelessness and believing that nothing is ever going to get better. And Father Gregory was there. His stories helped me find light and hope when I thought there was none left to be found. Stories stick with us like that. Father Gregory's story is going to stick with me like that. And we should all stick with each other like that, as we all try.
We all try.
We all try.
We all try.
Right.
to find this light.
Together.
Together.